It's being described as another pandemic, the sharp increase in schoolgirl pregnancies during the past 18 months. Understanding why it happened is the first part of developing strategies to not only support these girls, but also make sure that it doesn't continue in this way. And I'm joined now by a specialist scientist at the SA Medical Research Council, Dr. Kim Jonas. Dr. Jonas, thank you so much for your time. I know that you've done a lot of research, both preceding the pandemic and also during the pandemic. What were the main reasons for this uptick in the number of pregnancies in schoolgirls?
Thank you, Sally. Good evening, everyone, and thank you for having me. Sally, first of all, we cannot ignore the impacts of violence against women and children in the country, which we've seen an increasing stats on it recently. So violence against women and children is one of the key drivers of teenage pregnancy, as 1 in 5 children under the age of 18 experience sexual violence. Adolescent girls also are not getting the contraceptive they need. That is, they have a high unmet need for contraception compared to the older women of their reproductive age. From our research, we found that a substantial proportion of adolescent girls and young women are not accessing the contraceptives and are not using them. Those who are using them, they are not using them consistently, which increases their risk of continuous getting unintended pregnancies. We also found that the majority of the adolescent girls did not use condoms at last sex, which means that half of them were also exposing themselves to HIV and other STIs, and also exposing their partners into contracting the virus from them.
So, you know, I want to jump in there, sorry, because the issue of not wearing condoms, you can only ask your partner to wear a condom if it's a consensual relationship. With the high levels of sexual violence, many of these girls would simply not have been given a choice because they were being raped, whether it's statutory rape or rape is rape, essentially. It does create a problem because there's a narrative out there that these girls need to educate themselves and not do these things. The reality isn't the bigger problem that it's one of sexual violence, that maybe many of these girls not being in school were at home and thus more vulnerable to predators. I mean, did you get any idea of how many of these pregnancies were because of the girls being raped, and how many because the girls were perhaps experimenting in their sexual relationships?
We didn't specifically specify whether these were rapes, but you can imagine that a 10 to 14-year-old in our country cannot consent for sex. It's under the age of consent. So those girls were having sex with, maybe having sex with partners older than them, and that is rape in our country. And other things that we found, that you mentioned that they don't have knowledge, they must educate themselves. If there's no public knowledge and they don't get education within the schools and within the health facilities, how are they supposed to get the information and the knowledge they need to educate themselves? In our research, we found that many of them don't know how contraceptives work. They don't have enough information. And when they get to the facilities, they are asked embarrassing questions and they end up leaving without getting the services they need. And this is a missed opportunity because at that moment when they're at the health facility, the health workers should use the time and leverage the opportunity to provide comprehensive contraceptive counseling and educate them with the different contraceptive methods that are available for them and help them deal with the side effects, which is another deterrent in using contraceptives because they don't like the side effects, they make them gain weight, they make them look not appealing, lots of other things related to the disliking of side effects, which a health provider can clearly eliminate that during the contraceptive and family planning counseling.
And you know, you've highlighted such an important point because if you are a young girl, and yes, of course, anyone over the age of 16 having sex with someone under the age of 16, it's statutory rape, i.e. rape. But the truth is, 2 14-year-olds agreeing to have consensual sexual relationships, that's not a criminal act in itself. But if that 14-year-old girl wants to go and get contraception and then she's met with judgment from the nurses, that is a real problem. And in terms of looking at strategies moving forward, how do we change an attitude like that? Perhaps a nurse who feels that she needs to tell this youngster the right thing to do.
Well, we can start by providing the contraceptive services to the school premises where we find the young girls the most. And the health workers need to be, there needs to be an intervention to help them deal with their negative attitudes. We can't run away from the fact that the girls are having sex, and they themselves, they've been teenagers before. They need to understand this and treat them with a friendly and warm, welcoming attitude when they come into the facilities. So our facilities from our respondents do show that they're not youth-friendly and they're not responsive to the needs of young women and girls in our country. And that's problematic because since those who have attempted to access the contraceptive to start with, they may not come back, and then that risks the continuous and adherence to contraception, which in the end we stuck with the same problem of continued increase in teenage pregnancy rates.
And your report also highlights that there are real health risks. I mean, it's absolutely shocking and horrifying and deeply worrying that girls as young as 10 are being raped and are falling pregnant. There are huge health risks for such a young developing body to give birth. But also you sketch out how there are risks to the future generation, to those children that are born if the young mum decides not to terminate. And this just becomes a vicious cycle. What would you say is the most important thing the government needs to focus on now to make sure that these high rates of underage pregnancy that we've seen in the pandemic do not continue into another year?
Improving the access to contraceptive services for young women and girls, this is a start off. We could increase the services and provide the free contraceptives within the private sectors, such as the retail pharmacies, bring the contraception to the places where the young girls are congregating in their communities, in the schools, as I've mentioned before. But also we can provide incentives for those who are accessing contraceptives and motivate them to continue using contraceptives. They could get monetary incentives, for example, for transportation costs, as well as they could get monetary to buy data so that they could have access to health education and continue informing themselves and educating themselves and having the free access to education and health services.
Yeah, important suggestions.
Another important part actually would be to really increase awareness of sexual and reproductive health and rights of adolescent girls and young women in particular, but also involve men and parents and caregivers in the communities. We can't really deal with the problem if we continue to isolate the young girls. They go back to the communities where these violence and sexual abuse are happening. So we need to engage and raise awareness about their rights and what they mean by no is no, and also promote and increase awareness about contraceptives.
Yeah, you're absolutely right. It is not just about educating young girls. It's also very much about addressing deeper community issues and problems. Thank you very much for chatting to us this evening. That was Dr. Kim Jonas from the South African Medical Research Council.